So here at the EHA 2024, I'm presenting an abstract on the combination of Mezigdomide with Tazemetostat and dexamethasone for patients with relapsed refractory multiple myeloma. So this is a very interesting story. It comes from some very strong preclinical data done really in the context of pomalidomide therapy, where the work was done to understand how myeloma cells become resistant to immunomodulatory agents like lenalidomide and pomalidomide. And what we're seeing is some pathways are particularly upregulated. So those are pathways that the cell uses to escape the effect of the immunomodulatory agents. One of those pathways is called the BET pathway. The other way is the RAS-RAF pathway. And the other pathway is the EZH2 pathway. And the good thing is all those three pathways are druggable. There are drugs approved in other cancers or in development that can inhibit those pathways and potentially enhance the activity of an immunomodulatory drug or cell mod. So this trial is pursuing all those three options. What we have here at EHA is the Arm A, as we call, which is the Mezigdomide with the EZH2 inhibitor. So this was a dose-finding study, and the good news is we reached the highest dose we tested without any significant new toxicity, without finding any dose-limiting toxicity. This was a population, it was only 12 patients, but it was a heavily pretreated population. A lot of patients with extramedullary disease, which is myeloma pockets in places other than the bones or the bone marrow, which we know are very difficult to treat. More than half those patients had received prior T-cell redirecting therapy, including CAR T or T-cell engagers. Everybody had triple-class refractory myeloma. So it's a tough population, even a more difficult myeloma than those patients represented on the Mezigdomide dexamethasone trial. And for those who are not familiar, Mezigdomide is a cell mod. Think of this as being an evolution of, Revlimid, Pomalyst, and so forth. And we saw some very good tolerance and very good activity. With Mezigdomide alone, dexamethasone, about 30–40% of the patients will have a response. We saw a response in the majority of patients here, including some deep and long-lasting response. So this is very preliminary data, of course, showing that the combination is safe, and that will perhaps become, in the future, an option, perhaps for those patients who are not, for whom is an oral therapy. So perhaps for those who don't want to go to the trouble of a bispecific or CAR T-cell therapy, but particularly for those who experience some disease control under those new immunotherapy, but then have the myeloma progress later on. This provides, hopefully in the future, a great option.